Good afternoon. This is Tim Todak. I'm the director of HDXWILL, and I wanted to be able to welcome everybody to our first web conference. This will be a series in which we will, it's intended to help current users with their HDXWILL CBCT to learn how to get the most out of their CBCT with the on-demand software. So this, during these web discussions, if there's additional topics that you want to have covered, please let me know. A couple housekeeping things. Some of the topics to be covered in these web series are going to be endo diagnosis, implant planning, orthodontic evaluation, fusion evaluation, and the TMJ evaluation. Okay. So at this point, I'm going to go over multiple ways to evaluate the dentition, focus on specific areas, and evaluate the tooth or area for endodontic procedure. I will begin with opening on-demand 3D and reviewing the model chosen. So I've chosen a specific model because it has some nice pathology and things we can work with along the way, and then we can work our way into other things as well. Going through this, the easiest way and the way that we've tried to teach this along the way is being able to do something in which we understand the picture that we're seeing. So everybody can understand our 3D image, and so that blue line indicates where we are on the axial view. So I can go ahead and start moving that up and down to be able to at least evaluate the dentition and see what's going on there. So in this case, that what we can do is we can go through and be able to look from top to bottom of each tooth. So in this case, we are on the mandible, and we can start looking at, and I'll blow this up so everybody can see, and we can start scrolling this down so we can move through the teeth, be able to see, again, you can see some kind of occlusion difference there going through, and being able to see all the way to the roots themselves, and being able to see the bifurcation of that root here. If you go up to the mandible, which I'll move up this way, again, same thing, we're going to be able to evaluate the teeth themselves and then be able to look through and move our way down through, so we can actually see in this case that this one splits into 1, 2, 3, 4 roots. And again, give you that ability to be able to predict what you're going to get into before you get into it. So moving around that, I'll go back and bring this back to our original screen here. There we go. So with that in mind, that we can go ahead and start making a general evaluation of the patient themselves. So let's go down to the mandible, and we can start moving our circle over to the left side, and then be able to tilt it so we can create that tangential view that basically spreads it out to where we can see essentially a buccolingual view in the top right-hand corner in the sagittal. On-demand software allows us the ability to be able to do that so that we don't have to turn the patient's head, and instead we can kind of keep with creating an image that we understand from the 3D image through the axial, and then getting into the sagittal where we can create an image that gives us a buccolingual view. That tooth is angled, so I will be able to kind of take the plane and be able to tilt it, so now I'm in the same plane as that tooth. So now what I can do is I can evaluate the teeth in the buccolingual and the mesial distal all the way through. So I'm going to open up buccolingual first. We can kind of take a look at it. If you look over on this screen as I scroll this, I'm moving that blue line out towards the buccal side of the mandible. So now as I move through, I can scroll with my mouse scroll through, being able to look at the tooth itself and be able to evaluate each tooth as it comes across. So in this case, I'll blow this up so it's easier for everyone to see. So in this case, you can see that we have a central cavity and a cavity over here, and we can move through, being able to evaluate the rest of the teeth as well. There may be something on this tooth as well, but we can move through and be able to go all the way to the lingual side, evaluating that tooth. Now, a number of you know who I am, and I came from orthopedics, and our rule was essentially one view means no views. So being able to take this and look at it from a different perspective, and be able to look at it from mesial distal. So you can see I'm moving my mouse up to the top and moving over because I want to be able to evaluate that first tooth there for if that's a cavity or not. And I'm going to go ahead and blow up that screen, and now I'm looking at mesial distal of that tooth. So now as I go through that tooth, I can kind of move closer and closer in. You can see there might be a faint cavity there, and it looks like there's actually a break through the crown itself. Moving through again to the next tooth, we know that there's a cavity in there. We're going to look through there as well, be able to see from a mesial distal perspective. And as we move more distal, you can see that that cavity is going to start to show up right about there. And then we're able to move it all the way through to where we can see the break in the crown as well. So as we go through, again, this gives us the ability to evaluate from a buccolingual to mesial distal perspective. Again, you can see even up above here, we can start to see that we can look at this tooth and we can actually see that root curving all the way across there. So let's kind of take a look at that a little bit. Let's go back to it. I'm going to bring it back to that. And so in this case, we're going to go ahead and look at the maxilla up here and be able to, again, focus on this tooth. But now, because I've moved with the maxilla, I can now get a better picture of the maxilla in my buccolingual view. Again, I'm going to move up, and I can be able to go from, again, I'll move it all the way from buccolingual. So moving from buccal to lingual in the maxilla, we can see that here's our tooth here. You can see a slight bit of sinusitis on top, but now we get a much more distinct view of our teeth from angles that we appreciate. I'm changing this view so that when I move into my mesial distal view, that it can be parallel with the tooth in a 90-degree orthogonal angle. So we can go through, evaluate all the teeth there. I don't see any sort of dental caries, at least within this view itself. But looking at the tooth that we have here, we can also go through that mesial distal, and there's that curvature of that root there. So going back, and let's take a look at it from the axial perspective as we go down that tooth. So this is from, I'm moving up to the crown and then moving down from the crown, being able to move through the canal, then watch the canal as it bifurcates, and eventually being able to see that we have 1, 2, 3, 4 distinct roots that will need to be taken care of if it was going to be an evaluation for, say, an endodontic procedure on that tooth itself. So now let's look at different ways in which we can then bring that evaluation and look at it from different perspectives. So as we look at that, there's a number of different functions that we have over on this side here. So currently we're in the 3D MPR view, which is, again, basically what we like to term as our diagnostic. This gives us the ability to be able to break down the images, be able to look at individual teeth. You as the dentist has the benefit of knowing when a patient has pain or problems associated with one side, so you can focus on it. But again, this also gives you the ability to be able to create those tangential planes all along the maxilla and mandible, so you can evaluate more than just the tooth that you're looking at as well. So in this case, we know that this one has 4 roots, so we can actually go through there and find a number of ways in which we can take a look at it. So if we were going to do an endodontic procedure, we already kind of have an idea that this may have a curve to it, but let's go ahead and kind of break it apart a little bit. So I'm going to take my 3D zoom, and I can center on that tooth itself, and I'm going to create a box just big enough for that tooth. What that will do is that will create a high-def 3D image over here, and I'll blow that up for everyone to see. Once you get in that high-def 3D image, that you can right-click to turn it, you can actually look inside the sinus as well. This gives you the view in case you're doing something like, say, a sinus lift for an implant, what have you. But this also gives you the ability to kind of see its interaction with the floor of the sinus as well. When we're looking at that, we look at it in the bone window. When we're looking at this, we're seeing bone here. We can change that bone window and put it into teeth. What teeth gives us is more of like an x-ray view of that same area. So now we can actually look in 3 dimensions and be able to take that tooth and take a look at it and be able to say that I see 1, 2, and then there's kind of a blur here to know whether or not that's there. Now this type of window in the 3D zoom is actually really good for post-procedural endo analysis, because the gutta percha or whatever you are obturating this with will be able to be seen very clearly in distinction from the tooth. So if you're looking to see if you've had completed the fill of the canal, or if you've gotten all 4, then this would be a great view to be able to look at it in. So now moving back, I can move back into 3D MPR. And let's find another way in which we can kind of take a look at that tooth and see the structures around it. So what I can also do is I can also do an oblique. What an oblique does is it allows me to be able to say, I'm going to pick the center of that tooth and I'm going to adjust a plane on either side of it. Once that's done, that gives me an enlarged view that I can now move 360 degrees around the object in which I'm looking at. So in this case, it's that tooth that we were looking at before. As we start to move around, that we start to see there's that curved root there. And in fact, it curves all the way back around. And so the question is, are we seeing two distinct canals? Are we seeing this curve all the way around? And that is what is giving us that signal that shows that we have 4 canals, or that MB2. So we can go all the way around. Again, we can see a sinusitis directly on top of that tooth itself. So, perhaps there is some pathology going on with that, but it gives us the ability to look all the way around the tooth and be able to see what we're doing ahead of time. So there's that curvature again, and we can be able to see that and know the process of what we're getting into. So now let's go back again to 3D NPR. I'm just going to reset the image so we can see it a little bit better and start from scratch. So now again, when I come down over here, I'm going to look down at the mandible. I'm going to go over and look at this tooth and create that same buccolingual view. So now I'm going to go ahead and blow that up. And we're going to get to that tooth that has the central cavity in it right there. So I'm going to blow that up for everyone to see. And I'll center it. All right, so now we're at that central cavity right here. So that's pretty deep into the canal and pretty deep into the pulp. So this is probably going to need an endodontic evaluation or a procedure associated with it. So in this case, we can do a number of different things to be able to prepare for what we're going to do. So in this case, if we know we're going to do that, we can do, again, that 3D zoom, so we can be able to look at the tooth inside the bone. We can also do that oblique like we spoke about before, and that oblique will allow us to be able to look 360 degrees around that tooth. So let me do that again for us, since we have a new tooth to play with. And now again, before we do the procedure, I can actually look around that tooth, be able to make sure that our canals are straight, or if they've got a curve to them, what the bony processes are around there, and evaluate it. We'll go back to here to 3D NPR. But then we can also go in, and I'll bring this back over here, so we can go in, we can start doing things like measuring the canals themselves. Now, the human canals aren't straight, so we're going to use the tape measure here, and we're going to be able to say that from the point of entry, that we have this here, to this here, to this here. We're going to go down this canal, all the way down to the apex. Now what you see here is measurements, so that you can be able to know that from the top of the crown, that once you get 4.28 millimeters in, now you should be into the pulp canal itself, and then be able to work your way down until you get a total number of the length of the canal that you're going to be working with. And that just gives you the ability to be able to predict how you're going to obturate it, what have you. So in this case, if you want to erase it, all you got to do is click on the number, click delete, and you're back to 0 again, and you can look around. Other ways we can do this is we've already talked about 3D zoom and oblique, but the CPR function's a nice function to be able to, again, give you an endodontic view or an endoscopic view of what's inside that tooth. So you can actually plot points inside the tooth. And in this case, I'm going to go down that same canal I just measured. And I'm going to keep in bone, go to airway 1, and this is going to be in the CPR function. Again, you're going to ask for it to be bone, and you're going to click airway 1. That will give you this endodontic view, or this endoscopic view. So now we're looking inside the tooth itself. So these data points have been created in the space in between, so we can actually start to see that we can start looking down those canals. We can see that this one is oblong, where the other one is a little bit more cylindrical on those. And so it gives you an idea as to how you're going to obturate that, how you're going to be able to take care of those. And in fact, you can see that this is a pretty open pulp canal. So you're going to be able to get in there knowing that you don't have a C-shaped canal or anything else that's going to hold you back in the process of being able to find these and obturate them to completion. Now, in this case, we can actually fly down that actual root to be able to see all the way to the apex, making sure that we don't have any strange bifurcations, anything else that we didn't expect along the way. So now we've created at least 4 different ways to be able to evaluate that for an endodontic procedure by being able to look through. We're going to measure. We're going to be able to look at it from a buccolingual perspective. We can break it apart with 3D zooms. We can look at that tooth in a 3D form, looking inside the sinus, outside the sinus, around in the bone. We can also do it changing the bone window. If we change it to the teeth window, that will allow us to be able to look at it more from an X-ray perspective, so we can look at the tissue, bone around there, but also see, again, maybe post-procedural, be able to see the obturations as they happen. Again, Oblique gives us that 360-degree view around whatever target that we want to look at. And finally, CPR gives us the endoscopic view, so we can actually look inside the tooth and be able to see the structures inside there. Now, not all the time are you going to find a tooth that's going to have a big enough canal to be able to give you a clear picture. So going over to someplace like this one over here, that if I were to do the same thing, and I'll move my cursor over, on this one here, that we may not be able to get, well, that looks pretty open and clear in there. But it just depends on if you have calcifications or other obstructions inside there to know that this kind of looks like it has something in the middle of it as it comes up top here, but it just may be kind of an infolding. But it looks like the canal itself is pretty open to be able to do something like a CPR function. But again, the idea is that with CPR function, so like with this one here, that we can go through and we can click on CPR, and plot points inside this tooth. But because the fact that there may be not enough space or too much debris, that we may not be able to get that picture that we had before. So again, we can look down in here and you can see there are some blebs inside of here, and that's either through artifact or through the fact that there's calcifications inside, but that we can still see the canals, so we can be able to look through them. So it's a function that if you have an open space, it can work very well to be able to give you that endoscopic view and be able to see what's going on. So now I've been asked before about, how can we get more distinct pictures to be able to look at, 2-point differentiation. So looking up in here, again, you can see that this one's pretty clear as far as how it evolves into the 4 canals here, or what we may think is a curved canal somewhere around in here. We also have the ability through the CBCT to do a free field of view. So going to my Will Master program, I can go through and do a free field of view here. And this would be when you actually obtain the image itself. When you do free field of view, it concentrates only on the area in which you've circled or the area in which you've chosen, and it creates it to where you can get down to 0.1 millimeter voxels, and that gives you the ability to kind of look at that a little bit closer. So this is a different patient, but again, just trying to give you a sample of an idea with being able to have this free field of view, is that I can now focus on just that section of teeth and then be able to evaluate. So again, I can still do the same where I can do buccolingual mesial distal and then evaluate that tooth as it comes across and gives you that. Now, a lot of times in free field of view, sometimes it's important to be able to, I'm just gonna move this here. That I can also be able to do what's called auto windowing. So a lot of times with free field of view, it may come out a little bit darker. This will help to brighten it somewhat, so you can get a little bit more detail, a little bit more contrast. But again, this gives you the ability to get that higher contrast along the way. So again, we can go through and we can evaluate as this thing splits down. We can see the roots split themselves. And again, this one actually bifurcates. So you have 1, 2, 3, all the way down to the bottom. And again, as a curiosity, you can see the tooth next to it, and you can see that it also seems to have a C-shape associated with it. So we move up. You can see the canal is there. And so we could even do things where we can evaluate that. So again, same thing, we'll do the oblique We'll center on this one. We'll open it up. And then that way we can kind of take a look at that tooth, look around it. See, we have open canals all the way down. You can see how close that is to the nerve. You see where it is in association with the nerve. We'll look 360 degrees around it to be able to note that as well. Now, a lot of these images are not with our new MAR. We have a precision MAR that's out that helps to reduce some of the metals. So you can see here, that even with these fillings, that you're getting a little refraction, that with our precision MAR, we actually get a much clearer view now. And you can actually evaluate right next to things like braces and implants, because you don't get that shadowing any further. So I just had a question about what are the field of views in the CBCT unit. So with the field of views, what we have is we have a field of view that is 16 by 8 as our maximum field of view, and we have another one which is 16 by 14.5. Now, the beauty in that one is the fact that you can be able to get anywhere from forehead all the way down to epiglottis. So if you're looking at moving your practice into airway management, that this gives you the ability to look at the full airway all the way back to the spine. It also gives you the ability to do cephalometrics through the CBCT. That'll be one of our courses coming up in which we're able to do this, to where as you get an image like that in this size, that you can see that this image now gives you the full face, and you're able to see the full airway as well, so you can make that evaluation. Now, the beauty of having either one of those field of views is that you can get the full dentition or the full face, full sinuses, what have you. But if you don't want to have that, if you're just looking for something like an endodontic evaluation, you can also do the free field of view mode. The free field of view mode allows you to be able to essentially mark off a space on the dentition that allows you to be able to just choose that space alone to be able to view it and take just an image of it. One of the benefits of free field of view is you can see here that with the full field of view, you get all the soft tissue and all the other structures around it. Whereas with the free field of view, it's going to focus itself on the mandible or the maxilla, so that you essentially don't have to worry so much about the soft tissue that may be included in your image as well. And again, just fun things you can do because of the fact you have a full face. That we could go in, and as I said in another discussion, we'll talk about the fact that we can do 3D cephalometrics off of this. We can add a patient's photo to the skull itself, so that now this becomes a great thing to be able to discuss with your patients about their procedure and their CBCT, is being able to have their personal image and then fade it out to their skull and then work into the 3D mode to be able to actually walk through their images themselves. So another question is smallest voxel to be captured. So with voxels, ours goes down to 0.1 millimeters. So that is the smallest that we have. Now, you may be seeing in the marketplace, you hear people talk about that they have something like a 0.8 or 0.08 or 0.07. We didn't choose 0.1 because we couldn't go any further. We did it because at a certain point, you're going to get more signal to noise ratio as you get into smaller and smaller voxel points. So we chose a clear voxel point and something that our algorithm can then make into clear pictures. So a lot of this out there is a lot of interesting marketing associated with people saying that they can do a number. But when you actually look at the images they create from it, because of the fact that they're looking for smaller and smaller voxels, that they may not get the image quality that you're getting with this size voxel, secondary and primarily because of the fact that you get such a signal to noise ratio that even any algorithm is going to have a hard time interpreting that. So we chose to keep ours at 0.1 so that we are able to give you the most information and the clearest information we possibly can without that distortion. Any other questions? Otherwise, thank you for attending our first webinar on the use of our on-demand 3D with our CBCT imaging that we have from HDXWILL. Again, if you have any questions, one of the biggest things about this is that for our customers especially, is that you always have our education line open. We have educators on standby. So that if you have any questions associated with this, I know that we move through this fairly quickly. But if you have any questions, please feel free to reach out on our 1-800 number, get on the education line, and one of our educators can either speak to you or be able to go in and team viewer with you if you have a specific case in mind that you'd like them to work with. Okay, well, I appreciate everybody's time today. And again, feel free to reach out to us if you have any other questions or anything else you want to have. This will be recorded and we'll be releasing the recording probably within the next 24 hours. So if you want to go back and review some of the ways in which we do this evaluation, we're more than happy to be able to give you that link and you can go through this video again. So there's a number of different ways. We never stop educating at HDXWILL. We want you to get the most out of your machine. Thank you for your time and have a great day.